Hi, my name is Dr. Redden. I'm a chiropractor here in Chicago, and I'm going to be talking to you a little bit about my treatment approach I take with patients when they come to me for a pain or a condition. First, I think we need to understand why these conditions occur. So let's take a little look at this chart here. These are the three dysfunctions which are the cause of pain, injury, and degenerative processes. The first one being the tissue extensibility dysfunction. Tissue extensibility you can think of as this normal muscle length, normal soft tissue and how long it can get. And the length of that tissue, if it's shortened, will restrict range of motion and movement. And the more we get restricted range of motion or movement, the more we get compensation. The same thing is said about joint mobility. We need properly moving joints. Properly moving joints or improperly moving joints that are stiff or painful or have adhesions in them that aren't working well are also going to restrict that normal range of motion, which is then going to cause you to do compensation. So you think of these activities as you're trying to do something, but you just don't have the range of motion to do it. We're going to compensate in other areas in order to achieve that motion. The last being the motor control, which is made up of strength and coordination. Strength and coordination is very important because you have to have both. If you don't have good strength, but you have good coordination, you're going to be weak at doing a task. If you don't have good coordination, then it's going to be kind of a sloppy movement. So we want to make sure both of those are normalized. When we look at the compensation that occurs between these, the overlap, the more overlap of these circles get, the more complex a patient's problem is. And sometimes the longer it will take to get a patient fully better. But that compensation is what causes the pain. And to understand this is that you could have pain in your lower back, but the compensation mechanisms would keep coming from a leg, tight hamstring and calf that restrict the range of motion of an ankle. And that causes some overcompensation as the patient's trying to move and run and do activities. The stress is ending up in the back, but the problem is being caused by the leg issues. So to look at how we can evaluate this, we got to look at three different examinations that we do with a patient. The first being biomechanical, the second being orthopedic, and the third being functional. With a biomechanical exam, we're really looking at the skeleton. We're really looking at how the structure of the body is put together. We look at everything from the feet all the way up to the hips, up to the neck, and how postural distortions are there, how we can have pelvic unleveling, and whether that's caused by a torsion of the pelvis or possibly a leg length discrepancy, or maybe an arch, or there's one arch imbalanced, or one arch is lower than the other. And that will cause pelvic unleveling as well and cause compensation mechanisms to occur. So these things first need to be corrected and removed. With them still in place, you're going to help the patient's pain as you treat it, but the pain will come back because you haven't corrected for those. The second exam we do is the orthopedic, really finding out what tissue is injured and what tissue is sore, because we really need to correct for that pain. We have to get rid of the pain, so we really have to figure out what's causing that pain so we can remove it. And the orthopedic exam, which is made up of range of motion, neurologic testing, orthopedic testing, palpatory testing, is really trying to determine that. The functional exam is what we're looking at is for those dysfunctions, the movement patterns that people have, what things are faulty in the way that they're trying to achieve motion. And we look at these and we look at strength and coordination issues with all our patients in order to determine what tissues are tight, what tissues are weak, what joints are moving well, what coordination issues they may have. So putting that all back together, we really figure out what's causing the patient's problem. Then we can apply the treatments to get them better much more effectively. So we start with chiropractic. Chiropractic is a great tool to help get the joint mobility better. So we use that to really restore that normal range of motion of the joints. To help with the tissue extensibility, we do stretching facilitated. We teach the patients how to stretch all those muscles that are restricting those ranges of motion. And we also incorporate using massage and acupuncture and help reduce the tissue tone, remove the adhesions and the trigger points that are in the muscles. Because if something's been there for a longer period of time, you're going to have more of this built up stress in that soft tissue, restricting that range of motion. It really helps. With the strength and coordination, we use physical therapy. Basically give patients a lot of exercises that are built from the ground up. We don't just start people off on a very advanced exercise. You really need to start from the very basic and very core of what you do. When it's basic and it's a very local exercise, we move it to a global movement that involves multiple regions moving at the same time, then the exercise is achieved much better, because the better the form is, the better results that the patient will get out of that. So just to summarize, we look at the dysfunctions that a patient has, we do a thorough examination, and we apply the modalities exactly where they're needed in order to help achieve the best results for patients. So we can get them better and keep them better. Thank you.